Thanks for taking the time to watch this video. We put this video together because you are either about to undergo lower extremity nerve surgery or you've already undergone lower extremity nerve surgery, and I want to make sure that you're fully aware of what to expect after surgery and what you should and should not do. Okay, you've gotten a whole bunch of information at this point, and some of it may be confusing, and it may feel like there's a whole bunch of stuff that you're not sure you understand. So I want to make sure we took this opportunity to provide you with this information in multiple formats. So you'll notice in your discharge instructions, and you should have received this in email as well, but you'll also have received it as a hard copy. You've gotten a sheet of paper that looks like this, okay? And these are your discharge instructions from our office, okay? These are very important. These instructions have just about everything on them that I want you to know, okay? They are customized for you, and you'll notice at the bottom of that page is my cell phone number. So if you have any concerns or questions, you can text me or call me. You'll also notice that among your discharge instructions is a piece of paper that looks like this, okay? And this has all the same information on it, just in a different format, so that it's easier for you. For those of you that find it easier to look at a graph like this, you have this available to you. You can share that with your family members also, so that they can get a sense of what to expect and how best to help you. Or you can share this with them. Some people find it's easier to look at this. Other people find it's easier to look at this. You have both of those available to you. And of course, we're going to cover a lot of the same material here in this video. That way you can reference it. Again, you can share it with family members. You can go over it as many times as you need to in order to make sure that you understand. And of course, if after you've watched this video a few times and you've read through the instructions a few times, you're still unsure about something, then you can email us at the office or at info@draguila.com. You can certainly give me a call or text me with the cell phone number that is on your discharge instructions, okay? One other piece of paper that I'd like to go over with you real quick is this one right here. You're going to see this in more detail in a second. This is very important, okay? There's a particular variety of Tylenol that we want you to use, and it says on here which ones you should use and which ones you shouldn't. So take a look at that when you get to that portion of the video, and that should make more sense, okay? One of the things that a lot of people want to know about is their stitches and their bandages. And in addition to the usual instructions about the bandages, there's also some information I want you to know about your surgical shoe, okay? So let's start with the bandage first. So you'll see you've got a really big, bulky bandage on. And if you're watching this before surgery, you're probably wondering, what kind of bandage am I going to have? And so we've included a couple of pictures here of what the bandage looks like. It's really big, it's really bulky. It's going to make you feel like moon boots have come back into fashion. And that's most likely the kind of bandage you have on right now. That bandage stays in place for 1 week after surgery until you come back to see us in the office, or if you're scheduled for another procedure a week from now, then we'll take care of that for you in the operating room, okay? After that bandage comes off, then we're going to switch to an ACE bandage, which you're going to wear at least for the 2nd week after surgery, and quite possibly for longer than that, okay? But that big bulky bandage stays on until you come back to the office. It's really, really important to keep that bandage clean and dry. So when you get in the shower, which it's okay to do, unless I've told you otherwise, when you get in the shower, make sure you keep that bandage clean and dry. So some people will use what's called a cast bag. If that keeps it clean and dry, that's great. Other people will use some big plastic garbage bags and duct tape that around their knee. If that works for you, that's great too. I have had patients in the past who have taken their leg and just stuck it out of the shower curtain and washed the rest of themselves in the shower. Again, if that keeps your bandage clean and dry, then that's good. That's okay. One of the other things I want to cover also is what you have on your foot, okay? So you will have something that's called a surgical shoe on your foot, either one that looks like this, okay? You can see it's kind of thin like that, and it's got a bunch of straps here on the top, okay? Kind of looks like that, all right? It'll be something like this, or you'll have another surgical shoe which looks kind of like this, okay? And you'll notice there are elastic bands right here and here, which you can use to tighten up and adjust the shoe. It's very important that you understand this is not a boot, okay? When we think of boots after foot and ankle surgery, those are devices that are designed to immobilize the foot. This is not designed to immobilize the foot. It's just to help make sure you don't wear through the bottom of your bandage, because you're going to be using that bandage for the next week. And so I don't want you to wear a hole in the bottom of it, okay? So that's important to keep in mind as well. Additionally, you'll also notice that for some of you, you'll have some oozing through the bandage. A little bit is okay. Okay, that's not unusual. It's nothing to freak out about. It is important to keep your foot and your ankle elevated whenever you're not walking, which brings us to the next point. Okay, it is important that you get up and walk around. You should do that at least every hour. I do want you walking on this foot, unless I've told you otherwise. And the only exception to that would be, well, there are two exceptions. Number one, if we told you don't walk on the foot, then obviously I don't want you walking on the foot. But then the other thing is, if you found that you have some significant numbness of your foot after surgery, then don't walk on that foot until the numbness goes away, okay? And the reason for that is a couple things. Number one, we use what's called a special long-acting nerve block using a medicine called Exparel around the nerves at the end of the procedure. Okay, this is primarily to help you with your post-operative pain. The other reason that we use the Exparel, the long-acting nerve block or local anesthetic at the end of the procedure, is to decrease the likelihood of developing what's called complex regional pain syndrome, also known as CRPS. Okay. It's also sometimes called causalgia. Now, some of you may already have complex regional pain syndrome, and we found that using the Exparel at the end of the procedure in many cases can help with managing that and treating that. And for some of you, the reason we're doing surgery is to treat your complex regional pain syndrome. But for those of you that don't have it, we don't want you to get it. Now, I bring this up because some patients will find that not only does it help with their pain control, but it actually makes their leg really numb after surgery, and in some cases can lead to some weakness until it wears off. Okay, so if you have significant weakness or if you have significant numbness after the surgery, that's actually a good sign. That means that the Exparel is doing what it's supposed to do. If you don't have that, that doesn't mean it's not working. It just means that you have the effect we were looking for. The people who have the numbness and the weakness and the tingling afterwards are more sensitive to the effects of the Exparel. And that's the reason I bring it up, because if you're having significant numbness of your foot, then I really don't want you walking around on that foot until the numbness wears off, okay? Once the numbness wears off, then I definitely want you up and walking around. The reason I don't want you walking around when your foot is significantly numb is that you might end up twisting your ankle without realizing it, and then you end up in the emergency room for another problem. And so we want to prevent that. But the reason it's important for you to walk around is that we want you to decrease the risk of what's called a deep venous thrombosis or a venous thromboembolus. Okay, those are two fancy terms which mean the same thing, basically a blood clot in one of the deep veins in your leg. Okay, and those are particularly dangerous because those can break off and go to the lungs and cause significant harm. And so we want to do everything we can to decrease that. Walking around is one of the ways in which we decrease that. We also gave you what's called heparin either before the surgery or just before we started the surgery. That was the injection you got probably in your belly just before you went into the operating room. That's also to decrease the risk of deep venous thrombosis and the blood clot breaking off and go into your lungs. And then the other reason that we want you up and walking around is because when we decompress the nerve, one of the things we want is for that nerve to slide back and forth in the tissue so that it doesn't get stuck down and scar. Okay, Dr. Dellon actually discovered that gliding of the nerve immediately after surgery is really important to making sure that you don't end up needing more surgery later on down the road. Because if you immobilize the foot and the ankle after this kind of surgery, the risk of you getting that nerve scarred down afterwards is significantly higher. And if it gets scarred down, then we've kind of defeated the purpose of the whole operation, because the whole idea behind the operation was to make more room for the nerve and allow it to move freely so that it can work the way it's supposed to. So that's the reason that we want you getting up and walking around. Okay. Again, let's go over it again real quick. Number one, you're going to have this big bulky bandage that stays on for the first week after surgery. Again, you'll see a picture here. Okay. You'll also have your surgical shoe, and that you should wear whenever you're walking around. When you're not walking around, keep your foot and your leg elevated at least as high as your hip, if not higher. This will help with pain, it'll help with swelling, it'll help with healing, and if you do have some oozing and a little bit of blood on the outside of your bandage, it'll help that as well, okay? The more your foot is dangling, the more likely it is to bleed. So keeping it elevated when you're not walking is a great way to avoid that. So let's go over activity restrictions. You'll hear different people talk about, oh, you should use hydrogen peroxide, you should use alcohol on your wound in order to prevent an infection. I would advise against that, particularly with this surgery. We don't want you using alcohol on the incision. We don't want you using hydrogen peroxide on the incision, and don't use Neosporin or anything else on the incision that we didn't explicitly tell you about, okay? If you have questions or concerns about that, send me a text message or give me a call. You'll notice that on the bottom of this discharge instruction sheet is my cell phone number, okay? All of my post-operative patients get my cell phone number, and so just give us a call if you have a concern. Send me a text message, give me a call. If what you've read and what you've seen and what you're hearing me say now doesn't make sense, that's available for you as a resource as well, okay? So you can get the incision wet in the shower, but please don't go swimming and don't take a bath until you've been cleared by me or Steve to do so, okay? Other activity restrictions. For the first 2 weeks after surgery, it is important that you not lift anything heavier than a gallon of milk, okay? For the first 2 weeks after surgery, don't lift anything heavier than a gallon of milk. The reason for that is that we don't want the wound popping open, and we also don't want you causing a bunch of bleeding that could occur if you overdo it, okay? So for the first 2 weeks, don't lift anything heavier than a gallon of milk. The third week after surgery, you can lift up to 20 pounds, and the fourth week after surgery, you can lift up to 40 pounds. After 4 weeks, assuming you haven't had any wound healing problems, there are no longer any activity restrictions, okay? But please try to stick with those activity restrictions in order for you to get the best results, okay? So that you have fewer problems and decrease the risk of complications, and so that you get a great result, because obviously we're going through the trouble of undergoing surgery. We want you to get the best results possible, okay? A couple other things. You'll notice that you have recommendations for a number of different medicines to help you with pain after surgery, okay? And those medicines have a particular way of being taken, and there are particular reasons for you taking them, okay? So I want to go over each of those right now. As far as pain control after surgery, it is important to take Tylenol extended release. Sometimes it's called Tylenol arthritis or Tylenol 8-hour. You will also have received this in your email, and you'll also have received it as a hard copy, okay? So you'll notice on here there's a picture of which version of Tylenol you should get and which versions of Tylenol you should not get. It's important to keep that in mind, because I want you to take this Tylenol every 8 hours. And if you take the wrong version, you do run the risk of an overdose. So make sure you have the right version, the extended release 8-hour Tylenol. You're going to take that 1,300 milligrams, which is 2 pills, okay, every 8 hours, whether you have pain or not. And that's important to do for the first 4 weeks after surgery. Okay, whether you have pain or not, unless you hear from me or Steve otherwise, take the Tylenol every 8 hours around the clock in order to help control the pain. In addition to that, I want you to take some ibuprofen. That'll be 800 milligrams every 8 hours. Now, of course, some of you are thinking to yourselves right now, okay, well, that means I have to take the ibuprofen at noon, and I got to take the Tylenol at 4, and then the ibuprofen at 8. The reason we chose the 8-hour Tylenol is to make it easier for you to keep track of your medicines. Tylenol and ibuprofen do not work the same way, And so it's okay to take both of them together. And we purposely chose this in order to make it easier for you to keep track of it. So let's say, for instance, you're going to take your Tylenol at 8 a.m., then take your ibuprofen at 8 a.m. also, okay? And then obviously 8 hours later, you would take both of them together. And so that would be, let's say at 4 p.m., you'll take both of them together. So take both of them together. That'll help you to be able to sleep through the night without having to wake up in the middle of the night to take the medicine for pain. Both of these medicines, it's important to take around the clock for the first 4 weeks after surgery, whether you have pain or not, okay? One of the reasons for that is that if you keep the pain under good control, then the likelihood that you'll need the oxycodone, which we're going to talk about in a minute, is significantly lower, okay? It's a lot easier to stay ahead of the pain than it is to try to catch up on it. That's number one. Number two, there are some studies which have suggested that in patients who undergo surgery, if you have better pain control early on, the likelihood of having chronic nerve-related pain a year later is significantly lower. And so we're trying to avoid that also. So it's not just to make you comfortable now. We're trying to get you a better result later on down the road. So it's important to take the ibuprofen and the Tylenol as it's directed on your discharge instruction sheet and as we're talking about right now, okay? The third medicine that I want you to know about is oxycodone. Okay, oxycodone is a narcotic pain medicine. You can take that up to every 4 hours. You can take up to 10 milligrams every 4 hours. All right, this you only take as needed. If you don't have pain, then don't take it. If you got a lot of pain, then take it, but don't take it any more often than every 4 hours unless you hear from me or Steve otherwise, okay? This is as needed. And of the different medicines we're going to talk about right now, this is the only medicine that you take as needed. All the other ones you take on a schedule regardless of whether or not you have pain, okay? So that's the oxycodone. And this is the one that most people are concerned about because they're concerned about the risk of addiction. This is the medicine that we want to try to minimize the use of if we can. But if you're having pain, it is important to take it because controlling that pain early on has, again, been shown to decrease the likelihood of chronic nerve-related pain a year or two later on down the road, okay? So let's talk about gabapentin. That's the next medicine that you're going to take, okay? Now, some of you will have been taking gabapentin before surgery already, and some of you will have been taking Lyrica before surgery already. If you were taking Lyrica, then ignore what we're going to say about the gabapentin. If you were taking gabapentin before surgery already, then these instructions might apply to you depending on the dose that you were taking. If you were taking a relatively low dose, we're going to increase that dose. We're going to talk about that in a second. If you were already taking a high dose, then you're going to stay on that. You'll notice the details for that in your written discharge instructions, so pay particular attention to that, please. Okay? Now, for those of you that have never been on gabapentin, or maybe you were on it in the past and now you're being asked to take it again, you should have taken a dose of gabapentin, a big dose, the night before surgery. It is important to take the gabapentin every 8 hours for the first 2 weeks after surgery, okay? The ibuprofen you're going to take every 8 hours for 4 weeks after surgery, whether you have pain or not, okay? The Tylenol you're going to take every 8 hours for 4 weeks after surgery, whether you have pain or not. The gabapentin you're going to take every 8 hours for 2 weeks after surgery, whether you have pain or not. Again, the reason for this is to decrease the risk of chronic nerve-related pain later on down the road, in addition to helping you with your immediate pain after surgery, okay? So the gabapentin you're going to take for 2 weeks after surgery. The ibuprofen and the Tylenol you're going to take for 4 weeks after surgery. All three of those, regardless of whether or not you have pain, okay? The next medicine is a little bit unusual, or at least it may seem a little bit unusual at first, and it's high-dose vitamin C, 1,500 milligrams that you're going to take, okay, every day for the first month, for 4 weeks after surgery, okay? The vitamin C isn't a nutritional supplement in this case. This isn't because we have some concern about whether or not you're getting enough vitamin C or whether or not you have some kind of nutritional deficiency. The reason for the vitamin C is that in some studies it's been shown that using high-dose vitamin C after certain types of nerve-related procedures, it can decrease the risk of what's called complex regional pain syndrome, which is a nerve-related pain problem, which is chronic pain that typically won't show up immediately after surgery, there have been some studies which have suggested that taking the high-dose vitamin C will help with chronic nerve-related pain a year after surgery. Okay, it'll prevent you from having chronic nerve-related pain a year later. Okay, so it is important to take it now. You're not going to notice a difference now in terms of how it makes you feel. It will make a difference later on down the road, and so that's the reason for taking that. Okay, the only other medicine that's on the list, I know it seems like it's been a long laundry list of medicine. The other medicine that's on the list that's important for you to take is minocycline. Okay, now for those of you that are allergic to tetracycline or allergic to minocycline, you'll have a prescription for Bactrim instead. But either way, it's an antibiotic that you take twice a day. Every 12 hours, and you'll notice again on your discharge instructions it'll say exactly which medicine and for how long. Okay, so you're going to take that every 12 hours for 10 days. Please take it until it's all gone. We should never hear about leftover antibiotics. Leftover and antibiotics don't go in the same sentence together. Okay, so take those until they're gone. That's in order to decrease the risk of a wound infection. If you end up with a wound infection, there is a higher risk of having chronic nerve-related pain later on down the road, not to mention having a more prominent scar. So please keep that in mind. Try to avoid the risk of wound infection. Take the antibiotics until they're gone. Okay. The last thing I want to mention has to do with ice and heat. Okay, now you may have gotten lots of differing advice from different people about ice and heat. Okay, when it comes to this particular surgery, please pay attention to what I'm about to mention to you now. Okay, it's going to be different most likely than what you've heard from other doctors and from your physical therapist and anybody else as it pertains to ice and heat. And I'm going to go over why we choose to do things a little bit differently. Okay, so for the first 48 hours after surgery, you can use ice. Okay, and a lot of people find that it's helpful in terms of managing discomfort. So use the ice. Don't use it for more than 20 minutes every hour. Okay, but you can use it every hour, but not more than 20 minutes every hour. If you do it more often than that, you do run the risk of developing frostbite. Okay, and so pay particular attention to that. 20 minutes at the most every hour. Okay, that's for the first 48 hours. After 48 hours, do not apply ice any longer. Okay, you can use heat again for up to 20 minutes every hour. And the reason for that is that the ice is helpful initially after surgery because it decreases swelling by decreasing blood flow to that area. Okay, and it also helps with pain for some patients because it numbs up the nerves, kind of like just before frostbite, and that's the reason we don't want to overdo it, because you don't want to end up with frostbite. But the reason we switch to heat after 48 hours, which might be contrary to some of the things you've heard from other people, is that the heat causes the blood vessels to open up, okay, what we call vasodilation. And when the blood vessels open up, it increases blood flow to that area. It increases oxygenation. It increases the amount of nutrients that get to that area. And as a plastic surgeon, one of my highest priorities is making sure that that wound heals as well as possible and as quickly as possible. And the heat and the nutrition and the oxygenation and the improved blood flow ensure that that wound is going to heal as well as possible. Okay, by using ice, what you're doing is you're decreasing blood flow to the area. You're slowing down the healing process. Okay, now I'm not telling you to not follow your other doctor's directions if you've gotten instructions about some other kind of surgery and what they're telling you as far as ice goes. Okay, whatever your other doctor told you about your other surgery, follow those instructions. But when it comes to a surgery that I have done for you, please follow these instructions. Ice for 48 hours. Again, no more than 20 minutes every hour. And then after the first 48 hours, switch to heat. Do not apply ice any longer after the first 48 hours. Okay? Lastly, if you have any concerns or questions that were not covered in this video, or that weren't covered in the written discharge instructions, or there's something that you're confused about and you don't understand, that's a good opportunity for you to call our office or email us at info@draguila.com, or to send me a text message or call me. Again, you have my cell phone number. Every single one of my post-operative patients gets my cell phone number, so this is the time when you want to text or call if everything we've just gone over is still confusing or doesn't answer a question that you have. Okay, so don't be shy. Let me know if you have any other concerns or questions. And most importantly, please be careful and take care. We look forward to seeing you soon.